I had retired and we had some free time together to go do stuff. We would take small road trips and that. We'd go to Big Bear a couple of times a year and do some fishing and that. A little over a year later, that's when he had his stroke, and and everything changes. Your life takes a left turn that you didn't plan on. After he had his stroke, his right side was completely paralyzed. He literally could not walk. Little things that he was able to do before, just trying to open up a jar, he can't do it anymore. And then after his cancer, he can't talk now. It's hard for people to understand how hard it is when the person you love goes through this.
The thing that I'm very passionate about is helping patients. I really want to be close to them. I want to be there to help them. When they're down, when they're not able to overcome their difficulties, they're not going to recover. So that actually motivates me. 13% of all patients can have a secondary stroke. The purpose of this program is mainly to prevent them from having a secondary stroke. As a nurse navigator, I follow up with patients up to 1 year. We're going to call them from the day of discharge. Hey Susan, how are you? This is Selfie. In a week if they're high risk, and then monthly for 1 year. How is his physical therapy going on? I know last time we spoke you said... My role is to empower them, to educate them.
When Jack came home after the stroke, not only do you have to continue your everyday life, now you've got this other person that depends on you for a lot. Having Nurse Selfie call, checking on Jack to see how he is was great, but her calls for me meant a lot. Just seeing how am I doing. The support she offered was huge for us and for me.
Through kindness, through the consistency of the phone calls and that relationship that we build with each other, help motivate him to actually stay on track, to follow his diet, and also following up with his doctor.
If Jack could tell you, there's not a better place we could have gone to. The staff, from the doctors, the nurses, the therapists, couldn't have been better.
We enrolled 278 patients over the 3 years. Only 8 came back with secondary stroke. When I see those patients improving, they're walking, it makes me feel proud and makes me really believe in this program.
Jack is where he is now because of the hospital and the personnel and the people who work there. No doubt in either of our minds.